Here we are.
Hello.
Hello again. The majority skipped, I'm afraid, but we are 3 strong people, 1 rheumatologist and 2 cardiologists, and I hope we can survive and discuss the details regarding the education in cardio-rheumatology. Cardio-rheumatology is an evolving field. There are many cardio-rheumatology departments coming up in the United States and one in Europe in Leeds. Professor in Leeds is Sven Plain. It's a pity that we haven't done something like that in Greece. However, we should keep trying to this direction, and we have to discuss the details about how we can organize the cardio-rheumatology educational program about both about the training of both cardiologists and rheumatologists. So, Manos, we are happy to see your slides in the field.
Thank you very much. So we are on air now, right now?
Yeah, you are on air.
Okay. Hi, Dr. Sweeter.
Hello.
So can you see my slide?
Yes.
Yes.
Okay, so I may start. So this I am a rheumatologist, and the occurrence of cardiac manifestations of any kind is a very common situation for us as we deal with patients with systemic autoimmune and autoinflammatory diseases. And this is the common grounds between cardiology and rheumatology, which is the intersection of any type of inflammatory pathways, along with vascular biology and systemic disease. And as I said, cardiovascular disease is found in multiple rheumatic diseases, either as a disease manifestation or as a comorbidity. We have inflammatory injuries, either autoimmune or autoinflammatory, in various vascular and myocardial tissues. Also, we have cardiovascular disease risk amplifiers, which are both the systemic inflammation, which is chronic, as well as the treatment itself. On the other hand, there is endothelial dysfunction. We can see it every day in research papers, which lead to accelerated atherosclerosis in our patients, along with thrombosis, metabolic syndrome, which is very common as a comorbidity. And above all, we share with cardiologists diagnostic tools and therapeutic interventions. So we have many common grounds between cardiology and rheumatology. And we have also a perspective to improve and share both clinical and research issues, like the patient follow-up procedures, the cardiovascular disease risk calculators, the imaging protocols, the interpretation of biomarkers, and we have also to better understand the interactions of drugs that we use along with drugs that we use for cardiac disease, and the long-term drug safety, such as in biologic and drug inhibitors, which is an issue of these days. So, coming up to the cardio-rheumatology education, the main purpose is to advance the knowledge, the clinical knowledge, and the clinical practice based on evidence-based knowledge. And of course, this is a goal, an interdisciplinary goal addressed in many specialties, apart from cardiologists and rheumatologists, also for internists and general practitioners, in medical students and medical residents, along with allied health professionals like nurses, pharmacists, and physiotherapists. So some potential educational topics are the cardiovascular disease risk assessment in autoimmune diseases, along with prevention and management, the role of inflammation in atherosclerosis, and the imaging for cardiac involvement in rheumatic diseases. Also, we might address the biologics and cardiotoxicity and preventive strategies and patient management for cardiovascular disease. So the main point of an international cardio-rheumatology education program, in my view, is first to set up an organizing committee. And I would not like to make a very ambitious program, but this organizing committee would have three main purposes. The first is to organize educational events, like annual hybrid meetings, like cardio-rheumatology meeting, like the one that we are in, webinars. I see some monthly short sessions with case discussions and question and answers, workshops, which might be practical, skill-based education. For instance, the cardiac echo in rheumatology or the MRI for myocarditis. And of course, in this system might be a CME accreditation program. The second part, in my view, is to build partnerships with academia, particularly with universities and hospitals which have already integrated cardio-rheumatology care in their everyday practice. Professional societies like the European Society of Cardiology, the EULAR, the ACR, and of course the national societies. And of course, some support from pharma and imaging companies. And the last, which I think the last issue to advance is an expert cardio-rheumatology specific consensus guideline framework. As you can see in the lower part of the slide, there are some already published recommendations from EULAR and the ESE working group that might be advanced in joint EULAR-ESE comprehensive consensus publications. For instance, unified screening and management to build unified screening and management protocols for rheumatic and musculoskeletal diseases, for instance, for cardiovascular risk, myopericarditis, atherosclerosis, arrhythmias, and so on. So I think with this slide, yes, with this slide, I completed my presentation, and I'm open for any discussions and comments you may have. Thank you.
Jörg, your opinion?
Yeah, I think it's a very good layout of what can be done. Thank you very much. I think this is like a multitasking approach, so several channels should be addressed, I think, if I understand your slides correctly. And I think this is a very good way to approach this, to get this more in a structured education program in different countries. I think, yeah, it's good to have meetings, to have workshops, and also papers, and then that would pave the ground for, I think, then to approach maybe ESE and EULAR for integrating this topic into their curriculum for training of cardiologists and rheumatologists. Yeah, I also put together a few slides. Maybe we can show them. It's a little bit the continuation of what has been shown by